Audible?
Yes, sir.
Visible?
Yes, sir. Hello and welcome, everyone. Thank you for joining today's session on your favorite channel, Cancer Reach. Cancer Reach is an initiative by our very own tumor defeater, Dr. Krishnamani, to spread awareness about cancer and help patients and caregivers access the right treatment at the right time. Welcome to today's session on survivorship and life after cancer. Cancer survivorship is more than just life after treatment. It is a critical phase that focuses on healing, monitoring, and restoring the quality of life of patients. As more patients live longer beyond cancer, survivorship care has become an essential part of comprehensive oncology. Now, without much further ado, let me begin by introducing our doctor to you. Dr. Krishnamani has been a key figure at AOI hospitals here in Hyderabad for over a decade, where he brings extensive expertise in managing solid tumors, hematological malignancies, and oncologic emergencies. He has continually advanced his skills through prestigious international fellowships, strengthening both his clinical acumen and global perspective. Throughout his career, he has held pivotal roles in leading cancer centers across India, earning the reputation as one of the nation's most trusted and respected oncologists. In addition to his clinical excellence, he has been actively involved in shaping cancer care policies and treatment protocols by getting involved in clinical research activities. Hello and welcome to you, sir.
Hello, welcome to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. And today, let's discuss about cancer survivorship, which is not commonly spoken, but which is extremely important from a patient and a caregiver perspective.
So, before we begin, can you explain what does the term cancer survivorship mean?
See, cancer survivorship is that field of oncology which deals with survivors of cancer treatment, and it's a holistic way of dealing with them. In very simple terms, it's about those patients who survive after their treatment is over. So, what do we think? The job starts in the hospital and ends in the hospital. Starts with diagnosis and ends with chemo or radiation or surgery, which is your treatment. But it's not true. There's a whole life after that for a patient after treatment. And cancer survivorship is about that. Cancer survivorship is how we take care of them, how are their follow-ups scheduled, how we look out for recurrence, how we look at their mental, physical, social, emotional well-being, looking out for late cancers, or looking out for late side effects of chemotherapy like heart, lung problems, so or blood cancers. Cancer survivorship is also about integrating them into the social fabric afterwards, because initially during chemotherapy and all, they'll not be very social. It is like they're getting them to the mainstream. It is also a lot about uh, the financial part, which again we don't discuss much. So during chemotherapy, excuse me, during chemotherapy or radiation or surgery, patients spend a lot of money. In a country like India, there is a lot of out-of-pocket expenditure, which is your financial toxicity. So it is like after the treatment is over, getting them back on their feet, getting them back to their job, they're becoming more independent. So cancer survivorship is all about this. It is like the part after their treatment is over.
So there is another phrase also which is used in this domain, that is quality of life. So quality of life and survivorship, how are they interlinked, or if they are different, how are they both different?
So quality of life is a not only for cancer, right? Now I tell you, I'll pay you 1 crore a month, no sleep, work 24 hours a day, okay? And lunch is not on time, breakfast is not on time. You don't get to meet your friends, no social media, no television, but you're going to be paid a fat salary. How many of us would want that? So So
Not.
not many. Some people will want, they are probably workaholics. This is just an example, very, you may call it a naive example, but what is quality of life? I should be able to eat on time. I should be happy. I should be without pain. I should be without suffering. I should be with my people. My happiness, I should have my. So that is where the definition of health comes in. Do you know what is health? Health is not, it is very beautifully written in the book Park, which third year MBBS students study. Health is not merely the absence of disease. If you don't have disease, doesn't mean you're healthy. Okay, you don't have disease, that's all. You may not have disease, but you may be a sadist, or you may be, what do you say, not happy at all from within, or you not like somebody else's success. So you're not healthy. You're not mentally healthy. So health is not merely an absence of disease. Health is a state of complete physical, mental, emotional, and spiritual well-being. Okay, so that is where what is your quality of life? Quality of life means mentally, physically, emotionally, spiritually, I should be fine. In cancer, quality of life means you should reduce my disease. Because of the disease, I have suffering, so my suffering should come down. I should be free of pain. Okay, I should be near normal as possible. I should be able to eat something. My nutrition should be okay, basically free of pain. And after all this, if you're able to prolong my life, that is well and good. On the other hand, if you tell somebody you will be bedridden, you cannot even get up from your bed for anything, but you will get 5 years of life, that is not quality of life. So longevity is not important, or not only important. The quality of that longevity, that is quality of life, is important. Always we say, right, quantity is not important. Quality is important. So survivorship is one part of the story. In the survivorship, or even before survivorship, when you're treating somebody, quality of life is important. When you're treating cancer patients, quality of life is one of the most important things.
Okay. So the next question is that what kind of physical side effects do cancer patients have long after the treatment is also over?
They may have obesity. They may have hormonal changes, especially women after chemotherapy. Okay, they may have an increased risk of osteoporosis, that is, their bones may become weak. Infertility, okay, sterility, and obviously during chemotherapy there is loss of hair, darkening of nails, the skin becomes dark, loss of taste, and all that. Post radiation, sometimes you may, especially for head and neck cancers, you may have loss of saliva production, so they may have dryness of mouth, frequent mouth ulcers. If you are giving radiation to the prostate or that area, you may have frequent urinary tract infections, diarrheal episodes. To the lung, if radiation is given, they may have chronic damage to the lung, causing breathing difficulty on walking or on going upstairs, or chronic cough. On the heart, you can have effects because of a drug called adriamycin, anthracyclines, we say, that is called anthracycline cardiomyopathy. The heart muscle gets damaged, because of which heart is not able to pump properly, and the fluid accumulates in the lung and they get breathless. So these can all be the chronic effects of. So from head to toe, chemotherapy can cause chronic effects.
And sir, how do the patients manage these physical effects even after the cancer treatment is over?
Very good mental health, first of all. Tell your patients your treatment is over, you will recover. Once you stop chemotherapy, side effects usually start disappearing after 3 to 4 weeks. So our patients, we tell them, you stop chemo, within 1 month, hair growth will start, taste will come back, your energy will be good, and you will start, your stamina will be okay. 2 3 months later, the hair growth is even better. Weakness and fatigue also will come down significantly after 1 month. Eat a balanced diet, eat on time, do some yoga exercise, at least 20 to 30 minutes of brisk walk. at least 5 days a week. Okay, engage yourself in some activities. Could be with loved ones, could be some spiritual activities. Do what you like listening to music, gardening. So all these are important. But chemotherapy side effects usually disappear in the 3 to 4 weeks after chemotherapy.
So how, what kind of a gap do you give the cancer survivors? Like once the treatment is over, how many months or how many weeks of follow-up do you call them up for on a regular basis?
As a dictum, you can take it like the first 2 years, we call them once every 3 months. Beyond 2 years, if there is no disease, no recurrence, you call them once in 6 months. Beyond 5 years, you call them once a year. When they come, you'll have a history, physical examination. You will ask them how you've been doing, what's your weight, have you lost weight, are you eating well, any pains, any bowel bladder issues, any new complaints regarding the cancer which you had or regarding the treatment. How is your job? If you're a kid, which class are you? How is your the kids? We have to check their height to see if they are growing as per the normal kids. If they're in the 90th percentile, we call that. So that is all they have to do. So first 2 years, 3 monthly, 2 to 5 years, 6 monthly, and after that a year, we do general physical examination. If it's a breast cancer, every year you'll get a mammogram done. Okay. If you have a colon cancer, every year you will get a CT scan and a colonoscopy and a blood test called CEA, at least for 2 to 3 years. So if you had a lung cancer, maybe you'll get a CT chest, maybe 6 months to 1 year. Apart from, I'm talking to you, these are the tests in additional. If you have ovarian cancer, a CA 125 blood test will be done if it was elevated in the beginning. So apart from history, physical examination, for each cancer, there are certain specific tests we do.
Now, sir, coming to the mental health part of the survivors. So, is it very common for these individuals to have post-treatment anxiety, depression, along these lines, along the spectrum of diseases?
To see any patient who takes chemotherapy, okay, good intensive chemotherapy, even young people, you should ask them what they go through. It is very difficult. So sometimes they can have those flashbacks after a few months, which hurt them badly mentally. That I was taking chemo, I had these side effects. So this is very common. That's why you have to constantly talk to your patient. You have to motivate them. Be realistic about your expectations. Tell them, yes, nausea, vomiting, loose stools, diarrhea, mouth ulcers, hair fall, all this will be there. It is temporary. Follow precautions, take your vomiting medicines, gargle well, eat on time, small frequent foods, homemade food, no spice, no chaat items, masala items, etc. So keep doing this, keep doing it, keep reinforcing it. Lots of vegetables, lots of juices, fruits, green veggies. So once you do all this right, over a period of time, they will take ownership of their health. They will start understanding, oh yes, you told me these side effects I have got. I know what to do. First cycle I had these. I did this, now I'm better. So slowly and steadily, once you give them ownership of their health, they will get better.
So, do hospitals or healthcare facilities have support systems or counseling options which we can recommend to patients?
Oh yeah. So each hospital has its own department. Today, psychosocial counseling in oncology or psycho-oncology is a very big thing. In the West, at least, in India, it is coming up, but you need more people. But again, you need to spend time with your patient. In our busy lives, when most doctors are very busy, when they have a very busy OPD, they may not be able to spend that much time with each patient. But it is ideal if the doctor who is treating can spend that time because that is more reassuring to a patient. The way I look at it is if I am a patient, I am your patient, for example. You come and you say, this is your chemo, that this is blah, 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 and you go away. And for my emotional part or for my chemo side effects part and all that, for what I'm going through, I have to go to a psychologist. Then I have a disconnect. I'll be feeling like, come on, this madam is just coming and giving me treatment and going. I have no connection with her. So in India, it works differently. We are all emotional people. So have a connect with your patient, sit with your patient. At least we talk to our patients. Even today, there was a patient who was a bit upset about chemotherapy, side effects. So every patient will not be upset on the same day, right? So that one or two patients take that extra time. We took the time with this patient. We called her inside. We had a private conversation rather than talking in the general room where other patients are there. We sat with her. We spoke to her. We counseled her. We reassured her. So that they carry for the next 2 weeks to 3 weeks. They keep remembering this because they are not going to come to hospital every day to listen to me. So when you spend that much time with them, so psychologist is okay, psychosocial counseling is okay, but it is the onus. I believe it is the onus of the treating clinician. My job is not only to give chemo to you. My job is not only to give chemo to you. My job is to empathize with you, make you feel comfortable, be realistic about expectations, be practical, take you on the right path, ensure that your journey is smooth, and be scientific.
What role do families and caregivers play in supporting a survivor emotionally and practically?
Big role. Now imagine you are living all alone in a house. You're working daily, coming home at 8 o'clock, hustle bustle of Hyderabad, local train, metro, that, this, you are tired. You have to come. If you had your mom, your dad, brother, spouse, somebody, you say, I'm so tired. Suddenly, they'll come and give a glass of water to you. They will take your bag. They'll say, Chalo, what happened? How was your day? Shall I make some coffee for you? This is one part. Imagine you are the same person. You're living alone in the city. You come home. You're so dog tired. You can't even get up from your sofa. But you're thirsty. You want water. You have to go. You have to take water. You have to prepare your dinner. You have to eat. So, if it is for a normal person like you and me, it makes so much of a difference that it is not just a companion, it is somebody at home, could be a friend also. You may be living in a PG also. Imagine for a cancer patient, he or she takes chemo and goes home and nobody is at home. They have to do all by themselves. Will they even have the energy to do? So, family plays a super big role. Family is not only for physical work. Emotionally, they will say, it's okay. Last chemo, you were fine. This chemo, some side effects. We will go through it. If there is anything, tell me. You need any medicines, I'll get it. Do you want me to talk to the doctor? What shall I do for you? Emotional, physical, mental, financial stability. You are off work. You have cancer, you're off work. Somebody has to pay for your treatment, right? Okay, your insurance is knowledge that somebody has to accompany you. They will put leave or they will come and get you. Such a big moral support. So our patients who come all alone and go, we sometimes feel very bad. Sometimes we see elderly patients. Kids don't accompany them. Nobody accompanies. They just come, they Uber and they go. We can see it is not that, and they are. I'm not saying you should not be independent. I'm not at all saying that. Elderly people in Singapore at 70, 80, they drive cabs and all that. I'm not saying that. There are also people are elderly people do a lot of work. I'm not saying that. But it's always nice to have someone around. So the family plays a very, very big role, that emotional role.
So, what advice would you give to cancer survivors who are considering starting a family or those who are facing fertility concerns? What advice would you want to give them?
See, the first and foremost thing is talk to your doctor whether you are ready to have kids. Because ready means what? You should be free from cancer. I took chemo last month and today I want to have children means no, it is not possible. It should not, it is not the right way. I should be free from cancer. Imagine if a patient has just finished chemo and within a year or something she conceives and unfortunately she has a relapse in 3 months. What are you doing? You have unnecessarily you've given birth to a child and you can't be with that child also because your cancer has relapsed and you have a limited survival. So you should be extremely sure that you are cancer free. That your doctor will tell you. Then you have to sit and discuss with the doctor the pros and cons, the side effects of that old chemotherapy or treatment on your fertility, how to proceed. all that. And physically and mentally also, you should be in the space to rear a child, especially for a mother after chemo and all that. How good are you in a physical rear a child for 9 months? Pregnancy has its own physical strain, right? And then lactation. So the first thing is relapse. Second thing is the effect pregnancy is going to have on your body, whether you're physically capable enough to take that. Mentally, in normal women after delivery, they develop postpartum depression and psychosis. Imagine many times cancer patients who have kids and ask, sir, will I get my children get this? So that fear will be there, right? You have a kid in front of you and you had cancer just till recently, and suddenly now within 6 months you have a baby and you feel, oh my God, will my kid get cancer? So those are all the issues.
Can you share a memorable patient story or an example that shows the strength and resilience of these survivors? Any one example from your clinical experience till now?
Many, but I'll talk about a lady. Uh, she's a patient of breast cancer. I will not take her name. Around 45, 50 years. Had chemotherapy and surgery. Chemotherapy, she had a bit of difficulty like other people. And then she fought her battles, finally came out of it. It's almost 6 months to 1 year now post chemotherapy for breast cancer. Uh, and she's a very positive lady. She takes music classes for her students. She's a trained singer, Carnatic singer, classical vocalist. She's a wonderful painter. Okay, so she does a lot of painting during her free time, reads a lot of books. So many such people. There's another lady who involves herself in social activities in motivating other cancer patients, in taking them through the journey of cancer and chemotherapy and other treatments. So each patient has a history. Each patient is a role model.
Correct, sir. So, would you like to summarize today's session in short?
So my last statement is what I would summarize. Every patient is awesome. They are great. They go through a lot of pain and suffering to reach where they are. And they deserve to be where they are. And we should only hope and pray that they don't get their disease back. And they live a healthy, peaceful life with their family and their loved ones. So cancer survivorship is a big field, is a very important field, which is, if not more, which is as important as the treatment itself. And let our patients understand that after the treatment is over, all of us are there to help them so that they will do well in their next innings of life.
Thank you for today's session, sir. Can you also elaborate a little bit about the second opinion campaign which you run?
So we are having a second opinion campaign on WhatsApp. Patients can send in the reports. It's a free second opinion, and they will get a reply back as nearly accurate as possible because we don't get to see the patient. It is just so that we are able to give them a direction on what to do. Patients from all over the country and even from the rural areas, they message us sometimes just to give them a direction so that they can go and meet a nearby oncologist. And this is free.
Okay. Thank you for today's session, sir, and thank you for talking on survivorship, which is not very readily spoken about on social media platforms. Thank you for this discussion, and we hope to see you again next Friday, sir.
Thank you so much.
Thank you,
Bye.
sir.